everyone, Dr. Kim here, naturopathic doctor in Toronto and Whitby, Canada, and I make healthy and happy periods possible. Today I'd like to talk about PCOS. PCOS is a condition that's been gaining traction for quite some time now because of its increasing prevalence rates over the past few decades. PCOS stands for Polycystic Ovarian Syndrome. It is a hormonal disorder that we see in women of reproductive age, and it is a condition that's quite commonly seen in practice. So if you have a general understanding of the menstrual cycle, you know that ovulation happens every month or every cycle. In PCOS, ovulation is infrequent or it doesn't happen regularly. You have this fluctuation in hormones that have just poked and prodded the egg cells in your ovaries, and these eggs don't fully mature. They grow into multiple cysts that we see on ultrasound, and that's why we have that diagnosis namesake. And because they don't mature, ovulation doesn't happen, hence the irregular periods. Now, some people won't have cysts on ultrasound. They will be experiencing other symptoms that can indicate PCOS, which is why the condition is called a syndrome. A syndrome is a bunch of symptoms that often occur together. So not having multiple cysts on ultrasound does not mean that you don't have PCOS. The presentation will be different from each individual. What is common for PCOS is the lack of regular ovulation, as well as the presentation of certain hormonal symptoms or characteristics. The chronicity and the multifactorial nature of this condition can make it a little bit trickier to treat, and especially for people who are trying to get pregnant, this can be a little bit intimidating. A diagnosis of PCOS is made when you experience at least two of the following symptoms. So the the irregular periods, the excess androgen levels, and the polycystic ovaries. For the irregular and frequent prolonged menstrual cycles, this is the most common sign. If you might want to consider the PCOS diagnosis if you have periods, you have 9 or fewer periods during the year, or if in between periods there's a gap of more than 35 days, or you have abnormally heavy periods. For excess androgens, or male hormones or testosterone, now these terms are used interchangeably. Having high levels of the male hormones or testosterone can impact and influence the body. And you'll see people with PCOS, they exhibit certain symptoms, such as hair issues. So PCOS patients tend to have hair that's falling and growing in the wrong places. So there's excessive hair growth on the face and body, or the hirsutism. There's male pattern baldness or hair loss. Then there's severe acne, and then oily skin and hyperpigmentation on the skin folds we commonly see them in your neck, the armpits, and the groin area. And lastly, polycystic ovaries. So on ultrasound, that's when we see that your ovaries are enlarged, or the eggs are surrounded by follicles. And having the follicles and the enlargement can impede proper ovulation. PCOS is also correlated with a condition called insulin resistance. What this means is that the tissues and cells in the body don't respond normally to the presence of insulin. You want insulin in your body because the insulin tells the cells to take in the glucose or sugar in the circulation so that your cells can use them for metabolism or for other functions. Genetics, lifestyle, dietary factors, these can certainly predispose individuals to developing insulin resistance. The excess sugar that's just sitting there is then picked up and taken by the liver. Now the liver converts the sugar into fat, so people with PCOS tend to have more overall fatty tissue. Evolutionarily speaking, it's our body's way of protecting itself by clothing the vital organs on the abdomen. And sugar, really, it's not protective when you have too much of it because it is inherently destructive. It can damage your eyes, your kidneys, your blood vessels, and it can make you more thirsty, more lethargic, and there's so many other symptoms. Because there's too much sugar going around, your body will still try to compensate and produce more insulin. On your lab work, your sugar and your insulin levels may still be normal. However, the insulin compensation process can still have a direct impact on your ovaries, in that it causes the ovaries to produce more testosterone. Having that surge of male hormones stops or slows ovulation, hence the progression of PCOS. Now, back to the abdominal fat story, the high levels of insulin can cause the testosterone in the fatty tissue to convert into estrogen excessively, and your brain senses this, and it's already overwhelmed with all the confusion, the commotion that's going on, and it causes an increased production of testosterones. Now, the excess in estrogens are again sensed by the brain, and so it tries to control that by hushing the production of hormones that will eventually result in poor follicular development. Now, there are many permeations in PCOS that can occur, but they aren't restricted to those that I've mentioned. PCOS is generally a presentation of so many different intricate hormonal imbalances that lead to the classic picture of male hormone excess, lack of ovulation, polycystic ovaries, and insulin resistance. And I'm sure by now most of you will find that PCOS can be intimidating to address. So key here is that we are doing proper lab testing in order to streamline your treatment plan according to your needs. It is important to be able to rule out other underlying medical conditions that could be present that's primarily disrupting your hormonal balance. Part of your management plan can include a comprehensive lab test, and different measurements may be taken. So a panel of your hormones, fasting blood glucose, fasting lipid panel, insulin, etc. Generally, the goals of conventional treatment are addressing type 2 diabetes if present, weight loss, diet and exercise, and medically inducing menstruation. Currently, the medical treatments for PCOS are medications. Medications are great for temporary symptomatic relief. They're great for offsetting the inherent risk of developing estrogen-related cancers and for stabilizing hormone levels. However, medications admittedly are not the greatest means for sustainably addressing PCOS. Standard medications include oral contraceptives, or OCPs. OCPs suppress ovulation, which is self-defeating because in PCOS you want to restore proper hormonal regulations, and you actually want the ovulation. Glucocorticoids and spironolactone are other medications for PCOS, and they address the male hormone balance. For those who have PCOS and who are trying to conceive, these people are given Clomid and some injections to stimulate ovulation. Another medication is metformin, which is also given to diabetic patients to counter insulin resistance. Now, these are great tools to start with, but you have to do your due diligence in researching the side effects and interactions and then long-term effects from a naturopathic standpoint. So how I would address PCOS. My main goals of treatment would revolve around ensuring that your blood sugar and insulin levels are stabilized. We want to ensure that you're getting your periods regularly and that you have healthy periods. We want to improve your progesterone production because that's what's going to carry out the menstruation. We also want to improve your fertility status overall and decrease the excess male hormones and hormonal activity, and so we're improving the symptoms, the other physical symptoms that PCOS manifests in. And we want to implement sustainable weight loss strategies and ensuring that you're getting exercises in your routine long term, because that's what's going to carry the improvement forward. Now, because the very cause of PCOS is unknown and having the condition can seem overwhelming, I like to guide people by emphasizing the importance of being rooted in the foundations of health. Stress management can be one of the most positively impactful things that you can do for managing PCOS. When you are in a chronic state or a constant state of stress, your body adapts to it by producing excessive levels of stress hormones. Your stress hormones have a direct impact on the balance of your sex hormones, and as we know, a little bit of stress can be good because it can give us the drive and motivation to pursue our goals and potential. But if stress is causing you to be constantly agitated or nervous or angry or irritated, then do whatever you need to do to help you be at ease. You can start with taking deep breaths, or actually making time to have deep breaths, or doing nothing, anything that can help you de-stress. If you need to seek professional help from a therapist or whomever, do it. Do whatever you need to do to be comfortable and be at ease. Physical activity is crucial for my PCOS patients. Ideally, you want to do 20 to 30 minutes of cardio in the form of high intensity interval training exercises, and you want to combine that with weight bearing exercises, because having the HIIT exercises and the weight bearing exercises is going to be an effective way to have weight loss. If you're starting off from zero workouts, then try to just move, have some physical activity, make brisk walking a part of your day. As long as you're breaking a sweat, exercise is going to improve your sugar levels and your insulin levels, and exercise can restore ovulation in the long run. You also want to avoid alcohol and smoking, so really be conscious when you're going out to social events. Try not to drink too much or smoke at all, because tobacco and alcohol can greatly impact your fertility status. These guys stress out your liver, they irritate your gut, they mess up your hormone levels, they bring more waste and unwanted products in the body, and those are just a few things, few reasons why you shouldn't be consuming them in the first place. Also, ensure that you are going to the bathroom daily. Having good bowel movements, so at least 1 to 3 times per day, and having firm stools that are easy to pass, that translates to ensuring that your hormones are properly metabolized and that the excess hormones are properly eliminated. And a good way to ensure that you're having good bowel movements is consuming adequate amounts of fiber. And I like to start off my PCOS patients with just having ground flax seeds during the day. Ground flax seeds is a great source of fiber, and at the same time it increases your sex hormone binding globulin, which really essentially filters out the excess testosterone that's floating around and can address two big things for PCOS. You also want to eat less red meat and refined sugars, because that's going to add to your fat and sugar burden in the body. If you must, then you might want to switch to leaner meats or grass-fed beef and complex carbohydrates in the form of fruits and vegetables. For improving excessive male hormone levels, you can also try spearmint tea. Taking spearmint tea has been shown to reduce hair loss and improve excessive hair growth. On the context of insulin resistance, you can try adding cinnamon to your diet. So adding a sprinkle of cinnamon here and there to your coffee, to your smoothie, or to your salads, however you want to do it, it can have a positive impact in your insulin levels. I know I've mentioned a bunch of things that you can try for PCOS in this video, and some of you might be excited to peruse some of them. I just want to tell you that you have to be sure to consult with a healthcare professional before you start any specific type of treatment, as they still might interact with any medications you might be taking or any medical conditions you might have. Now, I'd like to know if you or anyone you know has been diagnosed with PCOS, only if you're comfortable sharing. If so, how did you feel after being given that diagnosis? Are you able to find guidance and support for managing PCOS? Are you still, confused as to what you can do? So on that note, I hope you know that there is a bunch of resources online. There's online support groups, and this video too, this is just a start of your research or your resource hunting. So I hope this video helps you out. If this is something that you enjoyed watching, feel free to share and spread this to your network. You're also more than welcome to let me know what you think in the comments section, and let's start a discussion. Reach out to me via my website at kimabok.com, or you can book a free 15-minute consult with me at any of my 3 locations in the GTA. So I'm in Scarborough at Equilibria Health Center, I'm in the Beaches at Toronto, at Simple Cures Integrative Medicine Clinic, and I'm in Whitby at the Brooklyn Natural Health Center. So there will be more informative videos like this, and I really hope you enjoy this, so stay tuned. There's more to come. Thank you for listening.